So you went into Cleft Palate because you saw some great results from terrible situations, and something woke up in your head. Is that correct?
Right. It's probably a good way of putting it. That it just was something that intrigued me, something that I wanted to learn, and alongside that, I really had an interest in traveling to third world countries. For whatever reason,
So you actually went to some of the poor countries and got involved in some of the procedures?
Yeah.
Is there a group that's involved in that?
Well, I've been working with I work with one group in particular, a group called Healing the Children, and I've been on probably over 40 missions, 45 missions.
HealingTheChildren.org, is that it?
HealingTheChildren.org.
Okay.
And I've been one of their medical directors for years, and I've run teams. I've lost count, but I've been on probably over 40, 45 missions, 2-3 a year. Presently, I go to Colombia once a year to a city that last year we celebrated our 15th consecutive year, and we did over 180 cases in that last June. And recently, I started a program in the Ukraine.
Why the Ukraine?
One of my friends got involved with the Lifeline charity organization, and apparently they were interested in, they had a request to send teams to Ukraine, and they needed a surgeon, so I've been going to the Ukraine once a year and doing surgery and teaching there, and that's been a good program. It's not nearly as large as the program in Colombia, but it works for me. But I travel, like I said, I've been probably almost every country in South America and Central America at this point doing surgery. And I run 2 teams, one in Staten Island, one in Brooklyn. So my interests are really very strong in cleft lip and cleft palates. When I first started out, I was learning. Now my role as a senior surgeon, I teach a lot of young people how to do things. If you think about it, there's probably 15 or 20 surgical procedures associated with kids born with cleft lips or cleft palates. Obviously not every kid needs all 20, but you need to know about 15 or 20 different surgical procedures just to take a kid from start to finish. The combination of running 2 teams and traveling to third world countries has really given me a great opportunity. Number one, I've gotten to treat a lot of kids. Number two, I've gotten to work with really some of the world's best surgeons. And each one of them has shown me a little bit something that's molded me into probably a much better surgeon. So that, coupled with the work we do locally, is really kind of neat. I anticipate that I'll always be going to third world countries until my health is no longer an issue. But I go, like I said, 2-3 times a year, and that's what I do: is cleft lip and cleft palate surgery and other facial deformities.
So you became a doctor for the right reason?
Sure. Part of me. You can scan my wall.